Kenya has a challenging health landscape, with the rising burden of diabetes adding to it. Tracking diabetes comes with numerous challenges, and the World Health Organization predicts a prevalence of diabetes in Kenya at 3.3%. It also predicts a rise of 4.5% by 2025. However, 2/3 of diabetes in Kenya is undiagnosed. Thank you for tuning in. My name is Aida Munzati, and Health Nuggets starts now. Today, our focus is on type 2 diabetes. But first, let's start this conversation with Jane Modhoni Story, who has been living with diabetes type 1 for more than 35 years. According to her, one of her secrets to managing this condition is acceptance. Let's have a look at Jane's journey with diabetes.
So I live with type 1 now for more than 35 years. In fact, more than 35 years. And I am glad because for those 35 years that I have been living with diabetes, I can't complain. So far, God is on my side because I have not suffered any complication and I'm not expecting any. I'm going to live for long and healthy. And what is the secret of that you are living healthy with diabetes? The secret of living with diabetes, one, is acceptance. Yes, I have diabetes, so what? It is from there that you change your attitude. And you realize that because I have diabetes, and I would like to talk to many who are listening to me, that diabetes is not a disease. Diabetes is a condition. And why are we saying that it is not a disease? It's because it's not something you are waiting for it to come to an end, like malaria, like homa, or like any other disease. So it's a condition that you are going to live with it throughout your life. And remember this, that we pray God to give us so many years, like me, and the people that I educate is 120 years, that we are going to live with diabetes. We will die because of old age, not because of diabetes. Now, when you are living with diabetes, what are the key things that you are supposed to think of? One, you are supposed to think of your diet. So the key is that the food that you are going to eat or that you will be eating always has to, you must consider and think, the food that I am eating, how is it? Is it a balanced diet? Not just the word balance, but is it a healthy diet? Not any special diet. Because in old days, when I was growing up, we knew that, and I am sure even when I am talking, there are also others who are asking, oh, she's talking of diet, and the diet for diabetes is for the rich. It's not. Because when we talk of the healthy diet, what I'll do, I'll take my vegetables, that is managu, terere, the local vegetables, depending with where you come from. Then from there, you have your ugali. And your ugali, for example, don't go for ugali number one, the one sifted, but you'll take ugali, the one you have taken to the portion meal direct. That is the healthy diet. From there, you have your protein. Protein is not necessarily that is meat. You may have your beans, other kind of legumes like kamande. So you'll have to take a portion of it. So that is your healthy diet. Because you have taken protein, you have taken vegetables, and you have your starch. Then after, because you are not supposed to take your meals together with the fruit, during your snack time, that is either 10 o'clock or even 4 o'clock, you take your fruit. In between the day, from the morning to the evening before you go to bed, you are required to take water in between. Then the other portion that you are supposed to be very careful, it is exercise, mazoezi. How do you do your exercise? Many a times, people at home or even in the villages, they will ask themselves, the whole day I'm in the shaba or I'm doing my normal duties, then do I need extra exercise so that now I can be qualified I'm doing exercises? No. You can just do what you are used to do daily, but you do it now in a more programmed manner. Meaning what? Let's say you are digging let's say 80 by 80, a piece of 80 by 80, and you usually do that an hour. You do exactly that, but do it at 45 minutes. What does that one tell you? You have done it quicker. And when you have done it quicker, it means that your heart rate will increase. You'll even sweat and you'll feel that you have worked. If it is walking, for us walk, and you walk at maybe 10 kilometers for an hour, then you go for that 10 kilometers, 30 minutes, all 45 minutes. You'll see that the heart rate will change. So that one, the body already will wonder, what is happening? Because now I can feel the actual work that we usually do daily, but now it has changed. So we do skipping. That is one of us. Skipping, we time ourselves that you are skipping how many times in a minute. So we do skipping at home. We do yoga, dance. When you are dancing, you are making your body muscles relax very well. So we do failures exercises in the house. You can see in my field, we have a field there. So we also play football and other activities at home. So the exercises that you'll do, those are programmed exercises. And why am I doing the programmed exercises? Because there is a difference here, exercise and physical activity. When you diagnose the fear, now I have diabetes, what next? When is it coming to an end? My dear people, I love you so much. It's not coming to an end. What we are doing, we are managing. And when you manage your condition, you live very healthy. And actually, if you can look at me. Unless I tell you I have diabetes, no signs that I have diabetes.
Well, Jen's story truly indicates that the diagnosis of diabetes is not a death sentence, and that proper management with a positive attitude is key, not only for diabetes, but for any other chronic condition. Now let's get into a topic of discussion. Today, we look at type 2 diabetes. And just a recap from a previous episode that you can find on our social media handles, we looked at type 1 diabetes, and we got to understand that in type 1 diabetes, the body produces little or no insulin. And we also understood that insulin is very key in the production of energy. Today, we'll also get an expert's opinion in understanding type 2 diabetes. Dr. Eric Njenga is a diabetologist, and he explains to us what type 2 diabetes is and how it comes about.
If you have excess accumulation of fat, it makes it very difficult for insulin to actually work in the body, and that's called insulin resistance, which now leads to another type of diabetes called type 2 diabetes. So we also have the role of the alpha cells, which play a bigger role in the setting of type 2 diabetes. And these tend to produce a hormone called glucagon, which also makes it very difficult for insulin to act. We call it a counter-regulatory hormone. Because what it does specifically is that once it's released, it goes to the liver and causes the liver to actually produce or release excess amounts of glucose into the bloodstream. So diabetes can be viewed as an abnormality, specifically affecting the beta cells, which are destroyed by antibodies, like in the setting of type 1 diabetes. In the setting of type 2 diabetes, the function of the beta cell is also severely compromised, predominantly because of excess fat tissue. So you tend to get breakdown of the fats, which now makes it a very toxic environment for the beta cells. And as the sugars progressively rise, the high sugars themselves also become very toxic to the beta cells. Then we have the alpha cells producing glucagon, which will now lead to a further release of glucose into the bloodstream from the liver. Yes. And we don't have a very strong family history connection with regard to type 1 diabetes as compared to what we see in type 2 diabetes, okay? So in type 1 diabetes, unless you have a direct relative who developed type 1 diabetes at a very young age, let's say below the age of 14, that may give you a slightly higher risk. But on average, if I have type 1 diabetes, the risk of my children having type 1 diabetes is the same as you who does not have diabetes, okay? So the family history link is not very strong. But for type 2 diabetes specifically, if you just have one member of your family having type 2 diabetes, the risk is a staggering 25%. If you have 2 members, it's 50%. If you have 3 members, it's 75%. So in type 2 diabetes, which we see in the older age group, family history is a very important risk factor that we look at, okay? So in type 2 diabetes, it's very clear, it's a lifestyle disease. That's what we see in older people, but it's very important to note that nowadays we are seeing type 2 diabetes in very young individuals. because the pediatric obesity is rising. People are not as active as previous years, where people were more active. There was more space around for people to play. Now, as you're aware, we have schools without playgrounds, for example. We have schools in the middle of the CBD. We all live in high-rise apartments, and kids now are cooped up in apartments for the most part of the day. Things like lockdown, which we're experiencing right now, also limit physical exercise severely, not only in kids but also in adults. So we are seeing type 2 diabetes at a much earlier age. It's not unusual for me to see people at 25 years, 23 years, 28 years with type 2 diabetes, whereas previously people thought it was a disease of people who are 50 and above, but that has really changed. We're actually seeing a much, much younger profile of patients now with type 2 diabetes, specifically because of lack of exercise, specifically because of our poor diets, increased alcohol intake, increased smoking, and also the environment around us changing, making us less active. We use public, if you even go to the villages, people would walk longer distances, but now bodas are available. So we drive to every single place we can think of, or you can take a boda or public transport. So we're not as active as we previously were. And that's why type 2 diabetes is now the single largest disease pandemic that we're dealing with in the 21st century. And now we're actually at 425 million people globally, specifically with type 2 diabetes. We're not talking about type 1 or gestational diabetes, but 425 million people have type 2 diabetes. And out of this figure, only 50% of the people in the world with type 2 diabetes are known to be diagnosed. So half of individuals are walking around with type 2 diabetes and they don't know. As you're aware, these are called silent killers in the type 2 setting, because you can have type 2 diabetes with no symptoms at all, and you can walk around with a sugar of 20 for several years. Hypertension is another disease that is also called a silent killer. You can walk around with a very high blood pressure and not have the symptoms.
Veronica Wamboi started her journey with diabetes a few months ago. She was diagnosed with type 2 diabetes in 2019, and she shares her journey pre and post diabetes.
I am a diabetic, and I was diagnosed last year in November. So I'm still very new in this journey, and I had undergone a surgery. I had a brain tumor, so I underwent a surgery in India. And before I was diagnosed with diabetes, I was under medication after the surgery. So now I have to deal with the medication after the surgery and the diabetes. I remember my body changed. I used to get really tired, and at some point I would have like memory lapses, or what do you call them? I would be talking to you, then I pause and like I'm lost, I'm in a trance for a while. Then you'd have to call me, Veronica, Veronica. Then now I come back, and that's when now I would continue with what we were talking about. Then I used to get very thirsty, which I thought was normal. I didn't know it was diabetes. So what I used to do is I would go to the bedroom with like a 3-liter jerry can of water in a mug at night. And in the morning, I will have drunk like half or 3/4 of that jerry can, sometimes all of it. So at night, my nights were very sleepless, because it was drinking water, trips to the washroom, drinking water, trips to the washroom, things like that. And the funny thing, the thirst would not go away. Then the other symptom that I kept having was feeling tired. So I would wake up in the morning and I am tired. It's like I have done a whole day's work. I am tired. Even getting ready for work was a problem for me. I try my best to get ready for work. Driving was a problem for me. At some point, my vision was not very clear. So I would be driving and then my vision becomes blurry, so I have to park on the side for a while and then I continue. By the time I reach work, I'm already tired again. By the time it's 11 o'clock, now I want to sleep. So my days were like a juggle between feeling tired, sleepy, trying to work, thirst, and all those things. By the time evening reaches and I'm in the office, coming home was a problem because I was extremely tired. I have to drive all the way back. I'm tired, I'm sleepy, and there is traffic. So it was a real struggle for me. And when I reach home, I just want to sleep. I don't want to eat, I don't want to do anything, I just want to sleep.
Now, according to specialists, a normal blood sugar level ranges between 3.5 to around 7.8. But imagine walking around blood sugar levels of as high as 35.
We didn't think it was diabetes or anything until one day I was just seated in the house. I started having a headache, and I remember telling my mom, I'm having a headache. I feel like it's really far, but it's really painful. Then we sat, I took some painkillers, then I started throwing up, and the headache now became worse. So it was like a banging. My head was just throbbing. So my mom is the one who said, let's go and have it checked. I went to the chemist to check for them to test my sugars. When they tested, the machine just wrote error. You know, my sugars were so high, the machine couldn't read them. So we had to retest again. The third time is when it wrote 35. And my friend who I was with, she's a doctor, very nice lady, she's my neighbor. She told me we have to go to hospital. And for me, I didn't know how serious it was. I just thought it was the sense of, you're sick, we go to hospital, see the doctor, they give you some medicine, you go back home. Then she told me, no, this one, you have to pack your clothes because it's an admission. I was like, but I'm okay. I have gone down the stairs, I've come back up on my own. Because even when the machine read 35, the gentleman at the chemist was asking, how did I reach the chemist? At the triage, the nurse did the test again, and this time it was up to, I think, 36. And the nurse could not understand how I'm still walking and, you know. So for me, I didn't know diabetes. I didn't know what it was all about. I didn't know what the numbers should be. So I was wondering why are these people so shocked? Me, I was just thinking maybe my numbers are a bit off, but not that off. Until when the diabetes educator came and told me that my numbers should be within a range of 7 to around 10, and I am doing 30s. That's when I was like, yes, it was not good.
What's a normal blood glucose level? So if you don't have diabetes, then there are two types of sugars. There is a sugar when you wake up in the morning, which is called the fasting blood glucose. The normal value is between 3.5 to 5.5. Once your sugar is between 5.6 to 6.9, we now move to the next bracket, which is called pre-diabetes. Okay? Then once your sugar in the morning before breakfast crosses 7 or is equal to 7, that's diabetes. So 3.5 to 5.5 is a normal blood sugar in the morning before you take your breakfast. Pre-diabetes is a blood glucose value between 5.6 to 6.9. Once your sugar is equal to or more than 7, then automatically we make a diagnosis of diabetes. Then we have the second type of sugar, which is called the 2-hour after meal sugar. We call it the 2-hour post-meal sugar. So the best time to check a sugar during the day is to eat, then wait for 2 hours and check your blood sugar. Okay, that's called a random blood glucose, but it's more accurately timed if you do it 2 hours after your last meal. If you're completely normal, again, the value should be between 4 to 7.8. Okay, now between 7.9 to 11.0, again, we call it pre-diabetes. Once your glucose level goes above 11.1, equal to 11.1, then that automatically now becomes diabetes. Okay, so those are the normal blood glucose values. Your sugar also should not go below. If you're on treatment, you should not have a sugar going below 3.9. If any blood glucose level of below 3.9 for someone who is diabetic on treatment is classified as hypoglycemia. But normal individuals at times could go down to 3.5. Okay, so we'd say that if you're not diabetic, you should not have a sugar going below 3.5.
I didn't know, I just didn't know what diabetes was. I didn't know what to expect. And for some time, I think I was also in denial. I was thinking maybe it's something that you get sick, then you take medicine, then it will pona or get better. Shock on me, it doesn't. So I slowly now started researching and Googling and, just trying to learn what is diabetes, how does it come by, how do you live with it, what does it entail. And the funny thing is, the more you research about it, reality checks in and it hits you that you're not dealing with something that is small. This is actually a big thing, and it might be like for the rest of your life. So everything changes, and it's not easy. Yeah.
Hypoglycemia means a blood glucose level below 4. So if your blood sugar is below 4, then you'll tend to get certain symptoms which will tell you that your sugar is low. Sweating, confusion, dizziness, rapid heart rate, headaches are very common. What you actually see in terms of the symptoms that people get when their sugars drop. And to the severe extent, you can actually get people going into a coma. What is key is that if someone develops the initial symptoms but is still awake, just let them take anything that can raise their blood glucose quickly. A cup of juice or glucose tablets.
Well, as said earlier, the World Health Organization estimates that 2/3 of people in Kenya are living with diabetes and they do not know that they have this condition. And people still think that diabetes is a disease for the elderly. But according to statistics, diabetes is now very common in young people. Why is this? Dr. Eric Njenga explains.
So in type 2 diabetes, it's very clear, it's a lifestyle disease. That's what we see in older people, but it's very important to note that nowadays we're seeing type 2 diabetes in very young individuals because pediatric obesity is rising. People are not as active as previous years where people were more active. There was more space around for people to play. Now, as you're aware, we have schools without playgrounds, for example. We have schools in the middle of the CBD. We all live in high-rise apartments, and kids now are cooped up in apartments for the most part of the day. Things like lockdown, which we're experiencing right now, also limit physical exercise severely, not only in kids but also in adults. So we are seeing type 2 diabetes at a much earlier age. It's not unusual for me to see people at 25 years, 23 years, 28 years with type 2 diabetes, whereas previously people thought it was a disease of people who are 50 and above, but that has really changed. We are actually seeing a much, much younger profile of patients now with type 2 diabetes, specifically because of lack of exercise, specifically because of our poor diets, increased alcohol intake, increased smoking, and also the environment around us changing, making us less active. We use public, if you even go to the villages, people would walk longer distances, but now bodas are available. So we drive to every single place we can think of, or you can take a boda or public transport. So we're not as active as we previously were. And that's why type 2 diabetes is now the single largest disease pandemic that we're dealing with in the 21st century. And now we're actually at 425 million people globally, specifically with type 2 diabetes.
Diabetes can be managed with proper dieting, exercise, and medication, which can either be insulin or tablets. The cost of treatment can be very high for those living with diabetes, for in a day one can spend around 300 to 400 Kenya shillings.
Either we can use tablets if, for example, the sugars are not extremely high, we can start off with tablets, and we use a combination of tablets most times. If the sugar is not very high, you can start off with 1 tablet. You can add up to 2, 3, sometimes even 4 tablets, depending on how much tightness you're looking in terms of having the sugar controlled. But once we find that an individual has lived with diabetes for a long time, what happens is that once you're diagnosed with type 2 diabetes, you've already lost half of your beta cells. The beta cells are what we said produce insulin. So once someone gets a diagnosis of type 2 diabetes today, half the beta cells have been destroyed. And he said they have been destroyed because of the excess fat tissue and the excess sugars. From there, they will lose approximately 4% every year of their beta cells. So it's only a matter of time that someone with type 2 diabetes will end up having 0 beta cells, with the progressive destruction occurring at a rate of 4% per year. Once that happens, then that individual with type 2 diabetes and the one with type 1 diabetes, who now have complete destruction of their beta cells, become equal. And now they will both need one treatment modality, which is insulin. Okay? So insulin plays a very crucial role, but most times it's demonized, and people assume that if I'm having insulin, it means that I'm at a terminal stage for my diabetes. And people always remember that, oh, you know, my dad used to use insulin, or my uncle used to use insulin, then he was on dialysis, then he died, okay? But the reason why that happened is that insulin was started too late. So a lot of people tend to associate insulin with complications and with death, which is wrong. So insulin needs to be started at the right time and for the right indications. So it's not unusual also for people to come in. If their sugars are extremely high, then we just tell them, you know what, we have to go to insulin straight away. Most people like the convenience of tablets. It's difficult to inject, but if insulin is required right at the time of your diagnosis, then that should be the treatment of choice. And from there, we can decide whether we can reduce the dose of insulin progressively. It's possible to start off on insulin, and if your sugars get better, you can end up on tablets. And also there are individuals who start off on insulin, go to tablets, and eventually are able to control their diabetes by simple diet and lifestyle. Okay? So diabetes reversal is also a very new concept that's happening now, and it's actually being practiced. And we have centers running diabetes reversal programs right now at Aga Khan, Nairobi Hospital, at the Diabetes Management Institute. And that program has been running now for around a year. One of our colleagues who's pioneered this, called Dr. Dan Katambo, is doing an excellent job of diabetes reversal. So it is possible. Using diets, for example, the ketogenic diet, it's a very useful diet in the correct setting of type 2 diabetes, for example. And it's possible for you to lose a significant amount of weight. And if you lose the weight, then you don't require a lot of insulin. So if you are able to lose 10% of your body weight, if I'm 100 kilos and I lose 10 kilos, I will not require as much insulin as I was using before. And that can be achieved through a ketogenic diet. So that facility is available, and it's good for people to start asking, you know, am I the right candidate to be sent for a diabetes reversal program? I normally say for diabetics who are diagnosed at a young age, they are definitely candidates for going for diabetes reversal programs. But even those who are elderly can also move to this same platform. So all it requires is for you to be trained, good guidance from the doctor, and these are all things that are possible in terms of, so that's one of the newest things that we are offering now in terms of treatment. The beauty of diabetes management is if you are very keen with your blood glucose control, meaning that you check your sugars regularly, if you're in frequent consultation with your doctor, if you're following the medication regimens, whether it's insulin or tablets, as per the instructions given by your doctor, you can actually live many years without developing a single complication of both type 1 and type 2 diabetes. Okay? So for example, you have people who have had type 2 diabetes for 30 years and still don't have a complication. Okay? But like I said, why do you think complications would be very common in our country? And the reason is cost. The major issue that complicates management of type 1 diabetes is access to insulin, access to monitoring.
Well, feel free to visit our YouTube channel at CAC TV Kenya and have a look at the type 1 diabetes discussion we had. It will be easier for you to connect with this and even understand better what diabetes is, and you'll get to know what you might be doing wrong for you to rectify whether you have diabetes or not. It's very important for yourself and for those that are around you.
For me, it reached a point I just had to tell myself, this is one day at a time. You know, today, I live today, I try my best. Sometimes I don't get to do everything I'm supposed to do, like my exercise, my walking. Sometimes you have muscle cramps and you're not able to exercise the way you're supposed to do it. But I have learned to just surround myself with positivity. You know, sometimes the society wants to really push you to do so much, whilst you're the one who knows your body, you're the one who knows how you're feeling, you're the one who knows where your limits are, and sometimes you really want to take that walk and exercise, but you're in so much pain, you can't do it. And you don't know how to explain to someone that today I can't take the walk. So I have learned to try and do as much as I can, take my medicines the way I've been instructed to do, and we see how it goes. I always envision like a situation where, I don't know whether it's the government to come in or maybe NGOs to come in and help with outreach, because I don't think people are enlightened enough about diabetes, and people are trying to reach out to the rural person, the poor person who is diabetic, and they might not know. Like when there was a time when there was a huge campaign about HIV and AIDS, go get tested, know your status and things like that. I feel it should be the same about even diabetes, so that someone can go get tested, know how their sugars are, and if they are diabetic, then they should be able to access the medication, because when it's treated, you're able to do your day-to-day activities without, you know, without all the dangers that come with the diabetes. There is always the fear, but you're able to manage the condition and the situation and also have a positive outlook. Because for me, when I look back, I realized my sugars were not controlled for a very long time, but I didn't know it was diabetes. So I just used to live with it without knowing what is happening in my body. And I don't think it's a good thing. I think maybe if we are able to get more people tested, then we will be able to diagnose people much earlier for them to be able to avoid getting full-blown diabetes, because if you're pre-diabetic and you're told in advance, then you'll be able to take precaution, check on your diet, put in your exercise so that it doesn't develop into full-blown diabetes. And for the poor people who have diabetes, they're not able to afford the drugs, then we can be able to help. I'm sure there is a way they can be able to be helped so that they're able to access medication, to access their strips, for them to be able to control their sugars.
So the key thing is to ensure that, let's say anyone, I'd say, who's above 30 should be conscious about at least checking their blood glucose once a year to ensure it's correct and is within the ranges that we've discussed about. Diet plays a very key role. So again, ensure that you eat healthy. Half your plate to be vegetables. Try and reduce the amount of carbohydrates you're consuming. Avoid unhealthy foods, so the junk foods that we have, excessive red meat consumption, things that we also try and limit in terms of living a healthy diet. Sweetened drinks are one of the biggest culprits, so avoid those at all costs. Alcohol, smoking are also things that drive non-communicable diseases like hypertension and diabetes and cancer significantly. So those would be the key areas that ask someone to focus on. And very, very important, exercise. So most of us, even at a young age of 20 and 30, we don't exercise anymore. The pressures of work, I know, are there. We live far, we spend a lot of time in traffic jam. But even just trying to spend 20 minutes, you don't have to physically go to a gym. Do what you can. Now there are YouTube videos you can watch, and you can just exercise in the comfort of your home. At least do 20 to 30 minutes a day. Ideally 30 minutes, but at least, I say, try and at least get 15 to 20 minutes of exercise, if you can, at least 5 times a week to start with. And try and at least get the bare minimum of 30 minutes 5 times a week to ensure you're living a healthy lifestyle. So that's very, very crucial. Parting shot is that hypertension and diabetes are silent killers. So I advocate, always have your blood glucose checked at least every 6 months. have frequent blood pressure checks, ensure that your weight is within control. And in fact, a very important parameter for people to check is what is called their waist circumference. Okay? And that is a very sensitive marker of what's your risk of developing diabetes or cardiovascular conditions. So what we say is for men, at least try and keep the waist circumference below 88 centimeters, okay? And for the women, below 80 centimeters, okay? So those are very crucial things that are simple, and you can try and, so simple to do, simple to check, but have a very huge impact in terms of determining your future risk of developing hypertension and diabetes. Again, if you have a family history of hypertension or diabetes, just know that you have a very high probability of developing these conditions in the future. So again, just being conscious to live a healthy lifestyle. If you are a lady who developed diabetes in pregnancy, your risk of type 2 diabetes is as high as 30 to 50%. So again, lifelong follow-up and living a healthy lifestyle is very, very key.
Thank you to everyone who made this episode a success, and let's keep interacting on our social media pages at CAC TV Kenya, on Facebook and YouTube. Ask questions and also give recommendations on diseases and conditions that you'd like to be enlightened on. That is all we had for you from Health Nuggets. Be safe and stay safe. My name is Aida Munzati, and as always, your health matters.